I'm now here with Dr. Geschwint, one of the neurosurgeons with the Brain and Spine Center and Chief of Surgery at UPHS Marquette. Dr. Geschwint, now that we're back doing expanded types of surgery, what can we do to ensure the public that it's safe to come into the hospital for their care?
So I want to start by reassuring everybody that we have your best interest. We are here to help you and we're here to serve you. And as you know, when we had initial events with COVID, we changed our services. We went on to only taking care of emergency cases and we limited all our elective practices. Now we feel very confident that we can resume, and we have resumed normal care. And we're taking precautions to minimize your exposure. For example, we're testing every patient coming in to have surgery for COVID, so we're getting that screening done. And we're also limiting the visitors coming into the hospital. And we also have more than enough PPEs for our staff to stay clean and protected. We are taking care of all patients, COVID or non-COVID, with the right precautions also. So if you have been waiting to be seen or taken care of, you can come and feel very safe. We'll take very good care of you.
I also noticed when we walked in that the waiting room, you guys have made accommodations to keep people spread out, safe, and socially distanced. Anything you'd like to say about that?
Absolutely. So what we actually are doing is we change our format in clinics. We're trying to spread out patients so there's less time spent in the waiting room with other patients. And also we're keeping several chairs empty to keep our 6 feet distance apart. And when you come in, you may be brought into a room quicker and wait in a private room as opposed to being in a waiting room. Yeah, so we're doing that. Yeah.
Well, excellent. It was great. Thank you for taking a moment to visit with me.
Thank you
All right.
for coming.
Yeah, thank you. See you. All right, we're now with Dr. Hendren, one of our emergency room physicians. We've also a lot written actually about maybe some harm that might have come to some people by having avoided health care. And some people continue to avoid health care. Are you seeing people presenting now with some conditions that are maybe worsened than you would normally see them?
We're seeing both sides of that, where we're seeing people that are presented delayed, that are maybe sicker than they would have been if they had come earlier. And the other extreme is some people just not coming at all, even for illnesses that certainly we know are happening based on numbers, but we're not seeing them here in the ER when we probably should be.
Like STEMIs, for example?
Yeah, so exactly. So it's a type of heart attack, strokes, that we know there's been a national drop in these numbers, but not necessarily a national drop in the incidence of these diseases. So that's something that if you feel like you're having chest pain or significant signs of a stroke or a heart attack or other emergency, we're happy to see you. I'd like to see you.
I'm now here with Steve Baldoni, a member of our cancer center here at Marquette. Steve, thanks for taking a second to talk to us. So I know during the shutdown of lots of the rest of the hospital that the cancer center actually stayed open, providing vital care to patients.
Correct. I mean, cancer care is not something that we want to delay. It's so utterly important, and we're very committed to our community to do these services. So we've made every pains to make this a safe, healing environment. Everybody's wearing their personal protective gear, hand washing, social distancing, and I think we're very proud through this whole thing that people have been able to come in, be seen, have their treatment. For patients where they don't need to come in, we've done telehealth and talk to patients, but we want to make sure everybody gets the care that they need and not delay it.
Thank you. One of the other things that has been talked a lot about lately is sort of as hospitals nationwide shut down some of the services they provided, that patients have avoided, continue to avoid, or have missed important screening procedures.
Yes, that is important, and it's and it's a nationwide problem. But fortunately, as we're starting to open up our services, people come in and can have their screening tests. There need not be delays at this point. People should not be afraid to come in and get the services they need. And that's not just cancer care, that's all because I've done consults in the hospital for blood disorders and people who had chest pain who were afraid to come in, and then they had a major event and something that was avoidable. So we don't want people jeopardizing their health out of a fear that isn't founded from the standpoint of, if everybody practices social distancing, hand washing, and all that on both ends, patients and providers, people can get the care they need.
All right, Steve, thank you for taking time out of your busy day. And again, thank you and the
No problem.
entire team here in the Cancer Center for what they're doing
It's
to
our-
make people healthy here in the UP.